When you're living with diabetes, the first thing you need to understand is what truly triggers it and how you can start controlling it today. Many people believe the cause is only sugar, but the truth is that a much deeper factor is linked to the types of fats we consume every day. And today, I'm going to help you understand why your glucose rises even when you eat foods that seem healthy and what you can do to reverse this process. My name is Dr. Gabriel Mina, and with more than 25 years of medical experience, I want to welcome you to this space where we share practical, everyday guidance to help you improve your health. Thank you for joining from so many places. I know many of you are here because you're looking for clear answers and real tools to manage diabetes. Let's begin with the key question: what truly causes diabetes? It's not mainly hereditary, as many believe. It's not just about sugar either. Science shows that 3 major groups of foods directly influence glucose levels: carbohydrates, proteins, and fats. But the most important part isn't the category itself. It's the type of carbohydrate, protein, or fat you eat. Processed carbohydrates, animal proteins, and saturated fats from animal sources can trigger substances in your body that ultimately raise your glucose. And today, I want to show you exactly how this happens, because understanding the process will help you make smarter decisions in your daily diet. Welcome to my channel. Here we talk about full-body wellness, longevity, and natural, simple habits that help you support your physical, mental, and emotional balance. Take notes and share this with your family and friends so they can improve their health too. We upload new videos every day, so make sure to subscribe and turn on the notification bell. Before we continue, if you find this content valuable, something as simple as supporting the video or sharing it helps this message reach more people who need it. Thank you sincerely for taking care of your health and being here. Now let's get into the topic. For years, we've been told that carbohydrates are the main problem. But what truly causes glucose imbalance is the fat stored inside the body, especially saturated fat that comes from foods like chicken, cheese, milk, butter, and products with added sugars. When this fat accumulates where it shouldn't, such as in the liver or muscles, it blocks glucose from entering, and your pancreas has to work twice as hard, producing more and more insulin. Let me tell you something I see every day in my practice. Not long ago, I saw a patient whose typical, healthy breakfast was bread with cheese, a bit of chicken, and a glass of milk. But after that breakfast, her glucose would spike. Once she removed these saturated fats and replaced them with healthier sources, her glucose levels dropped so much that her endocrinologist had to reduce her medication. And this case is far from rare. It happens much more often than people realize. Let's look at what the evidence says. When someone consumes more saturated fat, their glucose levels rise significantly. In contrast, when they reduce these fats, their glucose stabilizes. This happens because fat accumulates in the muscle and liver, blocking glucose even when it comes from healthy foods like fruit or oatmeal. That's why many people believe even fruit raises their sugar, when the real problem is the stored fat blocking their metabolism. When glucose can't enter the muscles, the body responds by producing more insulin. That excess insulin is what eventually leads to stronger medications and even injectable insulin. This is why it's essential to understand that saturated fat, both the fat you eat and the fat your body forms from processed sugar, is a key factor in insulin resistance. Several studies show that fat can be deposited in the muscles within hours, causing glucose to rise even if you didn't eat sugar. In fact, if tomorrow you have butter with chicken or bacon for breakfast and then check your glucose 1 or 2 hours later, you'll see it spike. Imaging studies even show how these lipids settle where they shouldn't. We also know that if the liver receives more sugar than it can handle, more than about 25 grams per day, this excess turns into fat. That fat ends up stored in the liver and muscles, worsening insulin resistance even more. So, if you're living with diabetes or have high glucose, the first thing you must reduce is saturated fat from animal sources: chicken, dairy, butter, processed meats, and foods with added sugars. And in today's video, I'll show you 3 types of healthy fats you can use every day to support better insulin sensitivity. Before we continue, if this information is helping you understand your health better, I invite you to subscribe to Dr. Gabriel Mina's channel, activate the notification bell, and share this content with someone who needs it. This helps us reach more people looking to improve their lives through simple, practical habits. If you're living with diabetes, fatty liver, or high blood pressure, one of the most common mistakes is believing that sugar is the only problem. But what really raises your glucose and harms your health is the saturated fat you consume daily, often without realizing it. And this is where I want to help you understand how small adjustments can transform your glucose levels and your overall well-being. Let's take cheese as an example. To produce a single piece of cheese, you need about 5 liters of milk. Imagine the amount of fat and sugar that represents. If you eat cheese several times a day, that load eventually becomes fat that accumulates inside your body. And this isn't my opinion. Multiple serious studies show that when fat levels in the blood rise, insulin resistance increases. A question many patients ask me is why their doctor never told them that fats can raise glucose and only focus on removing carbohydrates. Sometimes people are even told to avoid fruit, which is one of the best foods to support health. The truth is that when we reduce circulating fatty acids in the blood, insulin resistance improves. If you eat the way I explained yesterday and reduce saturated fats for just 1 month, tell me what happens with your glucose. I'm confident you'll see changes. Evidence clearly shows that reducing blood fat lowers insulin resistance and hyperinsulinemia. This helps glucose normalize even in people who are thin, overweight, or living with type 2 diabetes. Many patients tell me that no one ever explained to them that certain fatty foods raise glucose, and they believed carbohydrates were the only issue. But when you eat too many fats, your body stores them in internal deposits that block proper glucose use. Let's answer a few questions as we always do. Luis asks why his neck is darkened and how to reverse it. That darkening is called acanthosis nigricans, and it appears when insulin levels are too high. When insulin rises due to resistance, these spots appear in areas with friction, such as the armpits, neck, under the breasts, or groin. To improve this, you must follow exactly what we've discussed. Eat more naturally, reduce saturated fats, and give your pancreas a break. Another frequent question is what to do when you already have insulin resistance. First, reduce processed foods to avoid excess sugar that later turns into fat. It's also important to moderate animal proteins, as they often come with saturated fat. Instead, incorporate more legumes such as beans, lentils, and chickpeas. And if you eat chicken, remember it often contains more hidden fat than you think. Karina asked what she could do for her hypothyroidism and how to join the program. I explained that we offer a structured 8-week process where we guide people from different countries to improve their health in a comprehensive way. More than 2,000 patients have benefited, and many manage to reduce medication under proper supervision. It's always important to work with accurate information and healthy habits. Let me show you something key about fat. All excess refined carbohydrates turn into fat. Animal proteins also contribute fat, and saturated fat directly causes insulin resistance. That's why, when we reduce these fats and increase natural foods, the improvements are noticeable. Let me explain something simple about the pancreas. Inside, it contains beta cells, which produce insulin. These cells do not multiply after age 20, you have what you have. When you frequently eat saturated fats, these fats accumulate in the pancreas and damage these cells. This is what many people refer to as fatty pancreas. And when these cells die, your ability to produce insulin drops significantly. Let me share a recent case. I saw a 58-year-old man with type 2 diabetes who ate chicken every day, believing it was healthier than red meat. But when we reviewed his habits, most of what he ate was fried chicken, cheese, and dairy. After reducing these fats for just 3 weeks and increasing beans, avocado, and cold-pressed olive oil, his glucose dropped to levels he hadn't seen in 10 years. Changes like this are very common when you make the right adjustments. Studies performed even after death show that when type 2 diabetes is diagnosed, about 50% of beta cells are already damaged. And as the years go by, that percentage continues to decline. That's why acting early, when glucose is just beginning to rise, is essential. You still have working pancreatic cells, and you can protect them. Many doctors recommend eating a little bit of everything, but meanwhile, fat continues damaging the pancreas until it can no longer produce enough insulin. That is the moment when injectable insulin is prescribed. But if action were taken earlier, the outcome would be very different. I also want to emphasize that fat, both the fat that comes from animal foods and the fat that forms from excess sugar, is what destroys beta cells. This is why I recommend reducing animal proteins and increasing natural foods such as beans, lentils, chickpeas, lupins, or peas. Research clearly shows that these foods support metabolism and protect the pancreas. The evidence is clear: saturated fatty acids and high blood sugar levels can destroy the cells that produce insulin. And when a patient begins changing their habits, their need for medication decreases because their body starts functioning better. Even with a partially functioning pancreas, if you stay active, glucose can enter the muscles without the need for extra insulin. Let's look at some more questions. Someone mentioned that after surgery for diverticulitis, they still had pain. In that case, the first step is to return to the gastroenterologist for a proper evaluation. Each case requires specific guidance, and guessing is not recommended. Another common question is what type of milk a child with type 1 diabetes should drink. Homemade almond milk is usually an excellent option. On my channel, you can find videos showing how to prepare almond milk, oat milk, and even sesame milk. Another patient asked about dark spots on her husband's legs. Very often, this occurs because small blood vessels are becoming blocked by circulating fat. If a change is not made in time, this can progress into serious complications. That is why nutrition is so important to prevent those vessels from closing further. Now let's talk about healthy fats you can use. Avocado is an excellent option. If you add a bit of avocado to your rice, you'll notice your glucose stays more stable. You can also use cold olive oil on your salads. And nuts like walnuts or almonds can be very helpful for reducing accumulated fat. Something I explain to my patients all the time is what saturated fat really is. It's the type of fat that stays solid at room temperature and, once inside the body, travels through the bloodstream and ends up damaging organs like the pancreas. If you eat as I've explained and reduce these fats for just 1 month, you will see a real difference in your blood sugar levels. Several studies show how beta cells die when exposed to saturated fats, while they remain stable when we consume healthy fats such as olive oil, avocado, or nuts. This is serious scientific information, but it's rarely explained to patients. I am often asked about fatty liver in pregnant women. In those cases, the most advisable approach is a natural diet based on fruits, legumes, avocado, nuts, and cold olive oil. And always follow the guidance of your healthcare team for proper monitoring. To make this even clearer, a saturated fat is one that is solid at room temperature. It is the type that harms your pancreas the most. When your triglycerides rise and the duct that connects the pancreas to the intestine gets blocked, the pancreas begins to damage itself. This is why avoiding ultra-processed carbohydrates and excess sugars is essential. Research clearly shows that high LDL cholesterol can also cause beta cell death. This explains why many people with elevated cholesterol develop diabetes shortly after. Before moving on, I want to remind you that fever in a person with diabetes is not normal. Fever is a sign of infection and must be evaluated by a doctor. As for kefir, compared to regular milk, it is often gentler and easier to digest. But if you can prepare it with almond milk, even better. We'll end this segment here. In the next one, we will dive deeper into the healthy fats that truly help and how to include them easily in your daily routine. If you are dealing with diabetes, fatty liver, or high blood pressure, it is essential to understand that many of the recommendations you heard throughout your life may have guided you in the wrong direction. A large part of the damage you now see in your lab results has a very clear explanation: the saturated fats you consume every day, often because someone told you they were healthy. In several high-quality scientific publications, including the journal Diabetes, it is explained that diets high in saturated fat damage and can even kill the beta cells of the pancreas. These are the very cells that produce the insulin you need. Meanwhile, many patients come to me after being told to eat chicken every day, believing that this was the healthier choice. But consuming the same type of food daily, without variety, eventually worsens insulin resistance. A professor of mine once said something I never forgot. When a doctor lacks knowledge in nutrition, it is not just ignorance, it is negligence, because poorly guided dietary advice can cost years of health. And when we talk about stress on the pancreas, We are talking about an organ exhausted by so much saturated fat. Let me tell you something I see very often. Several patients, like a woman I treated 3 months ago, were told by their doctors to just eat chicken. Her glucose kept rising, and she couldn't understand why. When we reviewed her diet, we discovered she was eating chicken almost daily, thinking it was the best choice. When she reduced that frequency and increased natural plant-based foods, her glucose improved within weeks. You can eat chicken occasionally. Once a week is fine, but not every day. And if you wonder, so what do I eat now? Remember that there are more than 3,000 natural foods you can enjoy. That is exactly what we teach in the program: variety, balance, and real food that truly protects your health. We even offer cooking classes, because eating healthy does not mean eating bland or boring food. Now, let me answer some frequent questions. For diverticulitis, fiber is essential. It protects, helps, and improves symptoms. And for children with insulin resistance, they can eat exactly what we are explaining here: natural foods, rich in fiber, with healthy fats and very little saturated fat. In the program, we perform personalized evaluations. Not everyone receives the same guidance because every body is different. Even if 2 patients have the same diagnosis, each receives a unique plan based on their labs, muscle mass, and level of insulin resistance. This is not like those appointments where everyone gets the same printed sheet. Here, we personalize every step. Now, back to something essential. In a study published in a journal dedicated to lipid research, it was demonstrated that saturated fats from animal sources are far more toxic than healthy fats like those found in avocado, nuts, or olive oil. Saturated fats trigger a progressive cascade of damage in both the liver and the pancreas. If you continue consuming these harmful fats, you will keep accumulating fat in the liver and pancreas, your insulin resistance will worsen, and even healthy foods like oatmeal will cause your glucose to spike. That is why making a change now is so important. And if you no longer have a gallbladder, you can use olive oil, legumes, nuts, chickpeas, and lentils without any issue. The real problem is saturated fat. Let me explain this more clearly. When the gallbladder is removed, the body forms a widened duct that continues producing bile. But if you continue consuming saturated fat, that duct can narrow again, and stones can form over time. It all starts with what you eat. Another frequent question comes from parents of children who already have obesity. An 8-year-old child weighing more than 100 pounds needs proper guidance, because the issue is not just weight, it is metabolic health. Action must be taken quickly and compassionately. Let me clarify something else. Excess protein also turns into fat, and processed carbohydrates do as well. But when you eat plant-based proteins like beans or chickpeas, it is difficult to overeat them because they fill you up and do not harm you. People with biliary sludge can also use olive oil without any problem. And regarding exercise, you do not need to eat meat to build muscle. Cows, for example, build muscle eating grass, although of course you won't eat grass. But you can absolutely eat legumes, which are the foundation of extremely powerful nutrition. Avocado, for example, is a wonderful food. I love it. It gives flavor to rice, provides healthy fats, and helps stabilize glucose. I eat avocado every day. I'm telling you this as a doctor and as someone who takes care of his own health just like you. When someone tells me that legumes make them bloated, what usually happens is that the stomach is irritated. Legumes are not the problem. It is necessary to check for gastritis, and if you've had discomfort for more than 3 months, an endoscopy can help understand what's going on. If you want to build muscle while having diabetes, the first step is to reduce insulin resistance. With high resistance, muscle simply won't grow. We fix that first, and then the body responds. Now I want to pause for something deeper, because many people write to me filled with worry, anxiety, or emotional pain. Sometimes life's challenges test us, but they also shape us. Recently, after reading a message from a patient, I remembered a verse that says gold must pass through fire to be purified. In the same way, we go through difficult moments to become stronger. I have had days where I feel like I can't keep going. Days where I've asked God, "Why did you leave me alone?" But God never leaves. Sometimes it seems we can't sense Him, but He is there. And in the darkest night, dawn is closest. I'm telling you this as someone who has also had to breathe deeply and ask for strength. If you're facing sadness, anxiety, illness, loss, or confusion, you are not alone. God is with you. Even if you don't feel Him, He hears you. When you cry out in silence, He is there, accompanying you, holding you, waiting for you to rest in Him. And when you do, a peace arrives that can't be explained. Join me for a simple prayer. Lord, thank you for life, for the trials, and for the growth they bring. Thank you for every person listening to this message. I ask that you give them peace, relief, and clarity. May they feel your embrace in the midst of any storm. And may each day draw them closer to you. Before I go, I want to invite you, if this message helped you, to subscribe to the channel, activate notifications, leave a comment, and share this video with someone who needs it. We upload new content every day to help you improve your health and habits with clear, practical, and heartfelt information. Here on Dr. Gabriel Mina's channel, we are honored to accompany you on your journey toward better health. Thank you for allowing us to help you. And don't forget, tomorrow we'll upload a new video. I'll be waiting for you, because each day is an opportunity to learn something that could transform your life.